But thank you very much. Thank you for coming. I want to thank everybody that's here, all the folks from law enforcement that are here behind me. We're here to talk again about the heroin crisis that we're all struggling with. And when I say we're struggling with it as a community, all of our communities are. There's no artificial geographic boundary between urban and suburban when it comes to the heroin epidemic. It affects urban areas, it affects inner ring suburbs, it affects outer ring suburbs. It doesn't, it affects the old and the middle-aged and the young. There's really no artificial barriers here. And our approach at the county has been that we have to deal with it as a public health crisis, and that means forming real partnerships between not just government, traditional government, but also including our health institutions, our treatment facilities, and law enforcement, and also building bridges between the federal government, local government, state government, and local government. And I'm represented here behind me, Sheriff Frank Bova, Dr. Joan Papp from Metro, and also Dr. Tom Gilson, our medical examiner. I also want to recognize all of the gentlemen from the West Shore Enforcement Bureau who are here. We're going to be making some announcements about how we're trying to work with them. I also wanted mention Mayor Tim DeGeeter, Mayor of Parma, who's been a great partner with this on a lot of issues, and including this. Since launching our initiative in September of 2012, we've continued to make some strides towards dealing with this epidemic. In particular, something that we've called, which actually predates me, called Project Dawn, which stands for Deaths Avoided with Naloxone. You're going to hear a lot about naloxone, and you should. I wouldn't say it is a cure, because the cure is ultimately going to be represented by people not using heroin or even experimenting with heroin, but it is a practical way that can reverse the symptoms of an opioid overdose, such as heroin, but not exclusively heroin, also things like prescription pain medication. Thanks to pretty widespread use of naloxone, Cuyahoga County has reported that over 60 possible overdoses were reversed. Prior to 2014, however, only EMS and emergency rooms could legally administer naloxone. Through the research that's been conducted by both Dr. Gilson and the Heroin Review Committee, and basically that process, and Dr. Gilson can talk about it at length more than I can, but the Heroin Review Committee is looking at kind of all the factors that led up to a heroin overdose and seeing if we can see patterns or things that we can identify as kind of the markers of a heroin overdose. Well, what we learned through that process is that while EMS responded to over 90% of heroin overdose deaths, the administration of naloxone only happened about 22% of the time, because frequently it was just too late to even attempt to implement a naloxone reversal. Today we're announcing two major programs to spread the distribution of naloxone and increase the use of this drug that we know can be so effective in these tragic circumstances. First of all, in the Sheriff's Department, Cuyahoga County is going to be training 57 sheriff's deputies to administer naloxone. These deputies are going to be part of our units that are more likely to encounter an individual experiencing an overdose. As many of you probably know, we've made a real effort in the last 4 years to put our sheriff's deputies out into the community more. We've done that through our impact unit and our warrant division and other things. And so the training of those 57 deputies are going to be deputies that are placed in those types of units. So it's our narcotics unit, our warrant division, the impact unit, the downtown services unit, the civil division, and the transport division. The second part of what we're talking about today is that the medical examiner through his office is going to be funding a naloxone distribution program for suburban police chiefs, and beginning with the West Shore Enforcement Bureau, or WEB. WEB has an absolutely outstanding record on a number of issues, but including narcotics issues in particular, and I'm familiar with that, not just during my period of time as a councilman and mayor of Lakewood, which is a member of the West Shore Enforcement Bureau, but even prior to that, the quality of their cases that I saw as a prosecutor is just second to none, and they're an excellent partner with us. So we're very happy to announce that partnership here today. Today, the medical examiner is going to award about 50% of the total cost of 380 naloxone kits to the West Shore Enforcement Bureau. It consists of the following municipalities: Bay Village, Fairview Park, Lakewood, North Olmsted, Rocky River, and Westlake. Last year, there were 194 heroin-related deaths in Cuyahoga County. And as you'll hear from Dr. Gilson, that rate has slowed, but we still have a long way to go. We're showing some progress, but not nearly enough. Naloxone is, in its distribution, is part of the solution to that problem. It is not a long-term solution to that problem. That's going to take many more resources and much more of an effort. At this point in time, I want to turn it over to Sheriff Bova to expand a little bit about what this initiative is and what you can expect from us. Sheriff.
To reiterate what the county executive stated, first of all, I want to thank our law enforcement partnerships. The Cuyahoga County Sheriff's Department is presently training 57 deputies, and they are within the narcotics unit, the warrant team, the impact unit, the downtown safety unit, our civil division, our SWAT team, our EMTs, our transport division, on how to administer the naloxone. The deputies in these units are the ones most likely in potential situations where overdoses occur. As we progress in this program, we will assess whether or not more deputies and/or corrections officers will be trained. We are attacking this epidemic from all angles: prevention, education, prosecution, and saving lives when able with naloxone. Thank you.
I want to recognize and bring to the podium Dr. Gilson for a few words. Doctor.
Thanks, sir. Yep. Good morning. I'm happy to announce today our partnership, which the executive mentioned, with the West Shore Enforcement Bureau to distribute naloxone to first responders, namely law enforcement. Back when we started to address the heroin problem, we noticed that there was a significant discrepancy with the number of people who died of heroin versus the number of people who were given the antidote by EMS. And as the executive mentioned, EMS responds to most of these fatalities, but only in 1 of 5 cases were they able to feel that the situation would benefit from the administration of naloxone. That's a big disparity, and I think what we have been trying to do through Project Dawn with Dr. Papp and now today with the West Shore Enforcement Bureau is to get the antidote out and make it more readily available. And I hope that the goal of this is to put another piece in the puzzle to reduce our really skyrocketing mortality with heroin. Naloxone, as the executive mentioned, is the antidote to heroin, and if it's given in a timely fashion, it reverses the effects of heroin so that a person who's basically on their way out because their brain is being shut down by the drug can be woken back up. And I appreciate the efforts of a lot of the men sitting behind me getting behind this. I think that this is something that is really more cutting edge and something that really required the support of folks to get behind so that we would do that. The other thing I wanted to mention today is that we are also releasing numbers not only from the beginning of this year, but also our cumulative study of heroin overdose in 2013. Some encouraging things that we're seeing this year versus last year are that we see fewer women who are overdosing from heroin. That number was riding around 25%. Now we're under 18%. So we're seeing some progress in some areas, and the absolute number is also down. We reported earlier that the number of heroin deaths for the first quarter of 2014 was down, and that did stay down relative to 2013. That did stay down also through the first half of the year through June. We're still waiting for some final cases to be finished prior to June, but I don't expect that number is going to rise. We had 97 deaths that were attributed to heroin either by itself or in combination with other drugs in 2013. That number's down to 90. And while I'm gratified to see that progress, I wholeheartedly echo Executive Fitzgerald's sentiments that we still have a lot of work to do. But, you know, I think with partnerships like this, we are headed in the right direction, and it's just going to require more work. But this is a good first step, or a good continued step. We've made a lot of first steps, and I'd be happy to answer any other questions afterwards. Thanks.
Thank you very much, Dr. Gilson. I want to recognize at this time Dr. Papp to say a few words, and then also if she'd like to do a demonstration about kind of the methodology of naloxone distribution. Dr. Joan Papp.
So thank you for inviting me here today. Since March of last year, Ohio has become one of 17 states that has allowed peace officers to carry naloxone. Since that time, we've also been able to expand our access in other ways, allowing nurse practitioners to carry naloxone, as well as the ability to prescribe naloxone to family and friends. I'd like to congratulate all of the police departments here who have taken this first step to develop a program within their department. It's a very big step, and I'm confident that this is going to go a long way to increasing the distribution and improving the safety of our Cuyahoga County residents who are addicted to opioids. With implementation of these programs, they'll be joining 70 other police departments across the country who have deployed naloxone within their departments. And so with that, I'm going to go ahead and give a brief demonstration of naloxone and how it will be implemented. Naloxone is, as mentioned, the antidote to heroin overdose, as well as, I think this mic's on there, as well as the antidote to prescription opioid overdose. It's been used for years among emergency professionals, EMS workers, emergency physicians, to reverse overdoses. And in the past, we've used it as an IV drug. We've simply adapted this medication to be given as a nasal spray. It is a prescription drug, but it is not a controlled substance. It is a very safe medication to use. In fact, if a person's not having an overdose, it's not harmful to that person and will have no effect whatsoever. So very simple to use. It comes as 2 pieces, and it just needs to be adapted with a nasal adapter. Very simple to do. On scene, you just remove the caps.
We do have county employees that have volunteered to be a live demonstration if you'd like to. It's a joke.
Screw the medication together, twist the adapter on, and then approach the victim. Stimulate the victim to assess if they're awake. If they're not responding, then proceed with the naloxone. Simply spray half in one side and then half in the other. Most victims respond very quickly, waking up within 2 to 5 minutes, and we do include a second dose of naloxone in case the individual does not respond with the first dose. But very simple, very safe to use, and as County Executive mentioned, we've had great success with our program. Since implementation of our program in 2013, we have had over 750 people enrolled in our community distribution program, and we've saved to date 63 lives from our program. So again, I want to congratulate all the police departments here who are employing this program. I think that this is going to go a long way to saving lives and improving the safety.
Dr. I just want to ask a couple questions quickly. First, there's no way to overdose from naloxone itself.
No,
correct?
This is the essentially it's a medication that reverses the effects, and it's not a controlled substance. So it's a prescription drug that binds to the same receptor in the brain where the opioid would bind, but it has a stronger bind to that receptor, and it essentially knocks that drug off the receptor and won't allow it to have an effect. And
when is it appropriate to administer it? In other words, if somebody has used heroin and let's say a first responder, but they're not comatose yet or they're not unconscious yet, would naloxone be appropriate as kind of a preventative, or would it not be used unless they were actually showing the signs of starting to actually becoming unconscious?
It's never going to be harmful to a person who's not having an overdose, and if a person is in the early stages of an overdose, the first thing that we would encourage the responder to do is to stimulate the victim, make sure that they're awake. If they're awake and they're able to answer questions, then we would not suggest giving naloxone at that time. However, we would still want to be watching the victim very closely and make sure that they don't slip back into an overdose, because an overdose can occur slowly over 2 to 3 hours. And during that time, although initially a person may be just sleepy, they can slip into an overdose and become unresponsive at a later time.
Well, that was going to be my last question. So in terms of how long of a window a first responder has, if somebody has taken a dose of heroin, they're unconscious, that process of their body starting to shut down, I assume, depends on height, weight, what the dose was, a lot of variables, but it could be anywhere from what to what?
It could be anywhere from the time that they inject the medication, inject the heroin, until 2 to 3 hours. Generally, the opioid will have an effect on the body immediately, causing the breathing to slow down, become slower, and the respirations become less effective at getting oxygen into the bloodstream, into the brain. And over that course of time, there is the window of opportunity to intervene.
Training of individuals for them to become competent in the distribution of administration of naloxone takes how long? How long is that process?
Very simple. The training that we're going to be doing today is going to take about an hour.
Okay. Okay.
Very easy.
Great. If there's questions from the media, the folks that you heard at the podium will be available afterwards. I want to thank them again. Thank you, Dr. Papp, Sheriff, Medical Dr. Gilson, and all the folks here from all the law enforcement agencies. Thank you for not just being here today, but for your professionalism and your dedication to this issue, and we're very happy to have you as partners in this. Thank you very much. Thanks for coming.